Tell us about COVID Aid and the work that you do.
So basically, I've been involved in the charity sector for 5 or 6 years, including as a trustee. And at Christmas time, like many other people, I was feeling very upset and powerless over what was happening with COVID-19. I started researching to see what else I could do. At that time, I realized there'd be no charity specifically set up to support everybody significantly affected by COVID-19. I realized there's some good reasons for that. The NHS, the social sector, the healthcare providers, charities, groups had all done great things. But to me, it seemed like there's a real opportunity to make sure that with the recognition that COVID-19 was going to be here for the long term, that there'd be a charity that could become the go-to organization. I wanted COVID Aid to be a really modern charity. So we're not about doing everything ourselves. We're very much about being open and collaborative and then looking to work with other organizations. So we basically, over the course of since January 2021, have been getting some great trustees on board, great volunteers on board. We launched in May, and since then we formed a lot of great partnerships, including being part of Alliance. In terms of the larger end, we're having conversations with the NHS. We've got a partnership with Marie Curie. We're working with Asthma UK and their long COVID diagnostic tool. But then we're also working with a breadth of organisations and groups, including smaller charities, grassroots groups, and everybody in between, just to try and do as much as we possibly can. And what we do is we basically host a supportive network. So we make sure that people and organizations can find the right help and support wherever they may go for that. So we do signposting to existing charities, organizations. We also provide advice and information. And then recently we just launched our community section, which is a managed social community where anybody affected by COVID-19 can join up, and they'll find live events. We're about to be on some courses, groups, and just basically have that safe space where they can have their issues dealt with.
Why were you drawn to join the Alliance membership network?
It was so important for us to join the Alliance because I think we really need to try and make sure that people's needs, patients' needs, but also just the needs of everybody is put at the centre of the support that's delivered. So what we're doing right now is very much trying to make sure that within our charity at every level, we have people with lived experience of COVID-19, whether that's long COVID, whether that's grief and bereavement, whether that's the trauma of hospitalisation, loneliness, isolation. There's so many different factors to it. And what's really important for us is that we're not trying to tackle all of those issues ourselves, because we'd be quite foolish to do so when there's already great organisations, groups doing that. So we basically look at how we can complement and support those. The idea of COVID Aid is that we want to be part of a supportive network. So when you have something like the Alliance that's already doing that and making sure that patients across Scotland can get the best possible support, wherever that may be, that really aligns with what we're trying to do ourselves. So we've already found by being a member, then we're already speaking to other organisations and looking at how we can do things together. Because definitely my own background with the charity sector, I think that's the best possible way to do things, is not to be competing for resources or for attention. I think by partnering together and then pulling our resources and our talents, then we can achieve even better things than before. So I'm hopeful that we can do that for existing members of the Alliance and for anybody else who's interested in COVID Aid.
For more information on COVID Aid, visit covidaidcharity.org or follow them on Twitter at COVID Aid Charity.